Hello, welcome back to our series on effective trauma treatments. Today we'll be talking about EMDR, which stands for eye movement desensitization and reprocessing. It's certainly a mouthful. That's why we just call it EMDR. My name is Kimberly D'Amico. I am a clinical mental health counselor. I'm an EMDR practitioner as well as a certified clinical military counselor. EMDR is a type of psychotherapy. It's a treatment that has had over 30 random controlled studies done over the years. The Department of Veterans Affairs has done a lot of research on this. They found it very effective for the veterans. The Department of the World Health Organization, SAMHSA, as well as others have done a lot of research on this. And I love this type of treatment, so that's why I wanted to share it with you today and educate just a little bit in a nutshell, just a few minutes. So this therapy is most useful for unprocessed trauma, which is usually termed post-traumatic stress, just because unprocessed trauma generally leads to post-traumatic stress. And that basically means the effects of the trauma continue on and on and on, and it starts affecting your daily life, with yourself, vocationally, in your relationships, etc. This type of treatment is also good for addictions, complicated grief. It's also good for panic attacks, phantom limb pain for those who've had amputations. It's good for people with just chronic stress, performance anxiety. It can be used one time to help someone pass a test, or an athlete, or maybe you're feeling anxious about performing, something like that. So it can be something simple as well. But I love using it for the veterans that I work with, veterans and their families, people with secondary post-traumatic stress, which is caregivers oftentimes. It's great for first responders, police officers, anyone who is really exposed to a lot of trauma in their line of work. It's also good for people who have life-threatening illnesses, people who've been diagnosed with cancers, heart attacks. Once you've had one, you're kind of waiting for the next one, and that causes a lot of anxiety in the person as well as the family members. So, and we'll do another series on using EMDR for medical conditions. EMDR has been around since the late 1980s. Millions of people have reported, having a lot of success with the treatment. So, and I can certainly attest that it's, in the clients I work with, it's very effective and it's very quick. The reason I love EMDR as well is because it doesn't require a lot of talking. We know that people with trauma do not like to talk a lot about the trauma, and sometimes it can even be detrimental if you constantly talk about the trauma, but you don't really do anything to help negate it. So that's the great thing about EMDR. So yes, initially a person will have to talk a little bit about the trauma, but the process is to allow the mind and the subconscious to reprocess really what happened in a safe setting. And then we're going to utilize both sides of the brain, bilateral stimulation. So by both sides, the left side of your brain being the logical, analytical side, and the right side being your emotional and subjective side. The reason this is important is because when we have a traumatic event, usually we process it just through the emotional side of what happened, and the subjective side. And then we often attach a meaning about it to ourselves, such as, it was my fault, I should have done something, I'm no longer safe. And then unfortunately, a person will carry this sense with them forever until, that traumatic event has been processed correctly. And some people, because of traumatic events, they never want to talk about it ever. They just feel that if they just bury it under the carpet, then they'll be fine. And they don't realize that that traumatic event affects them the rest of their life if they do not have it addressed appropriately. So the process of EMDR is fairly simple. Once the client has decided what they want to work on in this particular session, usually every session we just work on one event. We ensure the client is in a calm state of mind. We kind of work on a place where they can, go to calm themselves or to self-soothe, as some people like to say. And if during the course of the treatment, a person gets disturbed by the images or whatever, then we'll let them go back to the calming state. We also use scales, a scale of 1 to 10 to describe how distressing the event is. So once it starts, we're like, okay, this event, maybe it happened 30 years ago. How distressing is it today on a scale of 1 to 10? We start from there. Maybe it's a 7. So the whole idea is to get the event from 7 down to 1 or 0 to really just totally neutralize the how you respond to that situation that happened. Then I use my fingers, to help the client move their eyes from left to right. Okay, left to right. I know on the screen it looks a little slow, but it's left to right. Some therapists use a rod it's electronic, and they follow the dot and go left to right. Some children like to tap. You can tap left to right. With children, I even use a finger puppet sometimes, left to right, left to right. Children love finger puppets. So as we're doing this, I have the client just, recall the memory and have them just try to see the memory as, they're watching a movie, or we often say, just kind of see if you can watch the events change like a train moving in front of you. So again, it's not the person doing the work, but it's the mind. We have these wonderful minds that God gave us to heal. They can heal themselves. We just need to create the space for it. So again, as you're moving your eyes left to right, it's kind of imitating the REM sleep we get at night where we're dreaming. So you're just, again, initially thinking about the traumatic event, your eyes back and forth, and then I'll stop and say what you got, to the client, and they'll say, well, the scene changed. Now I see myself doing, what have you, and we'll say go with that. I'll go back and forth another 25, 30 times. I'll check in with the client. They'll say, oh, the scene changed again. Now I see myself, or something, in the event. It's changing. So it's changing for the better. So anyway, we're just going back and forth multiple times as the scene keeps changing. We'll check in. How's the distress level now? Is it below a 7? We want to see it decreasing down to 1 or 0. Where do you feel it in your body? Identifying where this person carries that stress, trauma in their body. And then again, by the end of the session, this event needs to be neutralized and they no longer feel it in the body where they were carrying it. Sometimes it will work itself up from your stomach all the way to the top of your head till it's gone. Anyway, it's not hypnotism. You're fully awake. You're fully in control. But again, the client is not doing a lot of talking. They're just observing what was happening in that situation. Because like I mentioned earlier, when we have trauma and when we remember it, it stays in that emotional state, which is the right side of our brain. And if we apply some logic to what really happened, sometimes that is what really helps us see that, you really were safe. You came out alive. You were safe. You're safe now. It was not your fault what happened. It's not your fault today. And anyway, the whole process works together and it's really effective for clients. The other thing is you don't necessarily forget the event, but it gets stored in the back of your head where your other memories that we usually forget get stored. So instead of carrying the memory here, it's being stored in the back with things such as what you ate last week, which you forgot about. That's where it gets stored. And the whole idea is for this trauma to not be resident within you and carrying this trauma within your body to where it's affecting you every day. Okay, so that's about it in a nutshell. Again, bilateral eye movements back and forth, just talking a little bit about the event. We get it neutralized down to 0. Each session usually lasts about 40 minutes. And when I say session, I mean you pick one thing that you want to work on of that event. So maybe it was the actual event, maybe it was something that happened in childhood that reminds you of the event and that made that event even worse. Or it could be something that happened last week. But we'll just pick off these events one by one and neutralize each of them until the client just feels like they're in control and they got their life back. So I hope this was informative for you. Stay tuned for more effective uses of EMDR for children, for mental illnesses, as well as others. Thank you, and I hope you have a great day.